Welcome everyone. Today in Principles of Human Movement, we will discuss the supraspinatus muscle. Location and function of the supraspinatus muscle. It is an intrinsic and aggregate action muscle, which means it simply that it works best in a group. This muscle acts upon the glenohumeral joint. So let's focus our awareness towards the superior aspect of the back, the noticeable upper trapezius muscle, and then underlying the upper trapezius muscle, we can find the supraspinatus. Its origin is on the medial 2/3 of the supraspinous fascia. So it's a deep cavity on the scapula, and the muscle fills the space. Its insertion is a bony target called the superior facet of the greater tubercle of the humerus, which is located on the upper arm. The main action of the muscle is abduction of the shoulder joint in the frontal plane. So initially it was thought that it initiated that action, but current research states that the muscle is active in abduction and throughout the range of motion of the shoulder joint. It also has a weak contribution to external rotation of the humeral head. So if you see external rotation, reaching back with your thumb up. It is the smallest of the 4 rotator cuff muscles, and collectively these muscles provide dynamic stability of the shoulder joint, and it helps to also limit inferior displacement of the humeral head. So, gravity pushing down against the shoulder helps to keep the head of the humerus approximated.
Hey, this is Jack at Anatomy Zone. In this tutorial,
All right, moving forward. Muscle anatomy and fiber arrangement. Looking at the animation on the slide, abduction is clearly displayed, and you can see the supraspinatus muscle highlighted in red. Its innervation is supplied by the suprascapular nerve. This nerve arises at the superior trunk of the brachial plexus, formed by the ventral rami of C5 and C6. Blood is supplied by the suprascapular and dorsal scapular arteries. About 90% of the blood is supplied through the suprascapular artery, and the remaining 10% is supplied by the dorsal scapula artery. The supraspinatus is a unipennate fusiform muscle that has double layers, an anterior belly and a posterior belly. The more fusiform-like anterior portion has a spindle shape, and it usually targets a bony prominence. In this instance, it is the superior facet of the greater tubercle. And the posterior belly is more strap-like, with its unipennate arrangement, means it has a strong contractibility. And this portion of the muscle terminates as about 60% of the supraspinatus tendon in the upper portion of the humerus bone. Muscle actions and usage. The photograph on the slide is demonstrating a warrior 2 yoga pose. You can clearly see the angle of the shoulder joint is in abduction. The arms parallel to the ground. We are isolating the rotator cuff muscles and the supraspinatus muscles. Collectively, the rotator cuff muscles provide dynamic stability to the shoulder joint by maintaining correct humeral head approximation with the glenoid fascia while moving through a wide range of motion. The main action of the supraspinatus is abduction of the shoulder joint. Its unipennate arrangement means it has relatively strong strength and endurance for its size. And it is active during most overhead activities in the sagittal plane, such as throwing or swimming. It's also active in yoga postures such as like handstand, warrior 2, and it's also active when you lift objects of substantial weight out to the side in the frontal plane, like as if you were lifting a dumbbell, doing some lateral raises. You strengthen both the deltoid and the supraspinatus muscle. Common injuries and their causes. The supraspinatus is the most injured muscle of the rotator cuff. It's smallest of the four and second strongest when compared to the subscapularis muscle. Some injuries can happen through severe acute trauma, such as the impact from a motor vehicle accident, the impact maybe falling from a high position, like say falling off a ladder or falling off of a high surface or chair, falling directly onto the shoulder can impact the shoulder joint structure and the soft tissues that support it. So that's one way that you can have a major injury to that area, but often and most commonly, injuries to the supraspinatus and the shoulder are due to muscular imbalance, maybe say from a previous injury that had not been properly rehabbed, or maybe becoming deconditioned because of a sedentary lifestyle, and then trying to lift a heavy object that's beyond your capacity could injure the shoulder or the supraspinatus muscle or tendon. Often also common injuries are from athletic chronic overuse, the buildup of micro tears and inflammation, not allowing proper time to rest. Also grade 1, grade 2 strains. It could happen from acute trauma or repetitive stress. And all of these injuries, if they are severe enough, could cause or lead to tendinopathy, subacromial impingement, and a supraspinatus tendon tear. Often, if the tear is severe enough, like a grade 3, where there's a full separation of the soft tissue from like its bony surface or its connection, this grade 3 strain or sprain would require surgical repair from a myoplasty or tendinoplasty to repair the injured muscle in the shoulder. And to diagnose those common injuries, there are provocative tests that are administered to reproduce pain in the affected shoulder. A few of those that specifically target those soft tissues to recreate the pain. You put the patient through these range of motion exercises, and if there's pain present, it's indicative of a positive result. These tests are the full empty can test, so bringing the arms out like in a scaption position to about 90 degrees abduction, 35 to 45 degrees horizontal abduction. You would externally rotate or internally rotate against resistance from the physician or the clinician. And if pain is present, then that's a positive sign. Also, the near impingement test, where you take the shoulder in full flexion, internal rotation while maintaining stability of the scapula. Pain is reproduced, then there is a subacromial impingement. The Hawkins-Kennedy test and the cross-arm test also are provocative tests to indicate a injury of the shoulder. Effective exercises for stretch. So when we take the glenohumeral joint into extension with adduction and internal rotation, we isolate the supraspinatus muscle. And I pulled this information directly from our textbook. Some simple stretches, starting with the regressions or the modifications. These are some physical therapy stretches that could be done if a positive test was given for maybe shoulder impingement or a supraspinatus strain. The pendulum stretch, you would take one hand and place it on a flat surface, and then the affected arm would essentially just hang, and you would sweep in a circular fashion, working circumduction of the shoulder joint. Another exercise would be prone external rotation. So the client is lying prone on an exam table or massage table. We bring the arm out to the side with a 90-degree bend and work from abduction to external rotation and back, right? Building and progressing range of motion in that affected shoulder or tight shoulder. We have another passive range of motion stretch from behind the back.
Take the stretched arm behind the back.
Some progressions of these exercises are, I'm displaying here some yoga postures that isolate this area. One is Paschima Namaskar, which is reverse prayer hands. You can see this gentleman here at the top has his arms around the back with the shoulder joint internally rotated and adduction. This will isolate not only the rotator cuff, the supraspinatus, but also the pec minor and pec major. Another yoga posture would be Prasarita Padottanasana C, or the wide-legged forward bend C position. In this gray photograph on the right, this lady is demonstrating, again, extended at the shoulder joint, internal rotation, isolating the supraspinatus in the shoulder. Finally, we have Madhachyasana C, the twisted sage pose, C position. It's a seated posture shown here in this white photograph. The trunk is rotated. One of the arms is bound around the lower leg and reaching for the opposite arm. Again, this is a deep twist that isolates the front of the chest, the shoulder girdle, and the latissimus dorsi of the back. On this slide, we have some effective exercises for strength. On this side, we have some modifications or regressions, starting with the physio ball combo 1, working Y's, T's, and A's. In this photograph, physio ball combo 2, working abduction, external rotation, and overhead shoulder flexion. This video here. And then 4-point quadruped with arm raise, starting to bear some weight on the affected arm or both arms, and essentially bringing the arm out to the side in abduction and forward in flexion, alternating between the sides for duration of time. Some progressions of these exercises are working the ball combo 1 and 2 and adding a little bit of resistance with maybe a weighted dowel or some low-end dumbbells. Also, another exercise to help build shoulder stability, namely in the rotator cuff, is the serratus and all the muscles that act upon intrinsically and extrinsically act upon the shoulder joint is the 4-point quadruped T drill. And it's demonstrated here in this video. Shoulder scaptions. Again, bringing your attention to this video here on the right. And then also another progression is external rotation with overhead press, shown here using a cable apparatus, and it's done from a half kneel position. And finally, we have myself in a photograph. This is an advanced yoga posture called Vashisthasana. It is a side plank variation, and this yoga posture demonstrates how the shoulder girdle provides dynamic stability during isotonic movements to an isometric hold. So essentially moving into the posture and then moving out of the posture, how the shoulder joint can stabilize and prevent the humeral head from displacing from the glenoid fascia. The closed kinetic chain of the grounded arm requires synergy throughout the upper extremity. So as we talked before, this is the supraspinatus muscle is an aggregate muscle, so it works best in a group. So all the muscles that act upon the shoulder joint from the inside of the joint to around the joint help to create synergy amongst the upper extremity. So in this posture, namely the grounded arm, the arm is abducted to about 90 degrees, and we see that the rotator cuff and the deltoid are pretty active in that position. With full elbow extension, we activate the triceps brachii, the anconeus. With forearm pronation, we activate the pronator teres and quadratus to stabilize the elbow joint. And with active wrist extension, we elicit the extensor muscles collectively, the extensor carpi radialis, longus brevis, the extensor carpi ulnaris, and also the brachioradialis. I want to thank you for your time in attending this presentation of the supraspinatus muscle. My name is Marcelo Martinez. I'll see you again. Thank you.